Check it out. It's the Laugh to Learn podcast. What is going on, everyone? Welcome to the Laugh to Learn podcast. My name is Jacob Paveo, and I come to you from the Great White North each and every Wednesday afternoon, 1 p.m. Eastern Standard Time. The leaves are turning different colors. Fall or autumn, depending on the part of the world you're in, is upon us. And I'm pretty hyped because the long-range forecast is calling for snow, which means hopefully in like 5 or 6 weeks, I will be on a snow hill again, riding my snowboard. But for now, this is, of course, the Laugh to Learn podcast. If it's your first time here, thank you so much for coming by. If you're a returning guest as well, thank you so much for coming back. If you haven't already, hit the subscribe button wherever you happen to be listening to. You can find all my social media links on the description of this podcast, wherever you happen to be listening, blah, blah, blah. It's a regular podcast. You already know what's going on. This week, we've got two things that I want to discuss. It's kind of weird because, you know, I was so used to for so long just being inundated with news. You know, Trump was president, COVID then starting up and being a major thing. I mean, as I say that, we're about to talk about COVID for this entire episode, sort of. But, you know, COVID being like overwhelming, society being completely shut down. It's just crazy. And all of a sudden, it's like the news stopped. And putting together the podcast is, again, kind of the way it was early on, where you have to really extrapolate for the news stories that you're using and what you're going to talk about. But either way, later on today, we are going to be talking about the U.S. reopening their land border to Canadian citizens and Mexican citizens who are fully vaccinated. But first, the big story to discuss right now, here at least in Canada, it's a Quebec-based story. But it's something that we're starting to see roll out across the country, where provinces have set dates whereby all individuals working in medical fields, working in healthcare, I should say specifically, they need to be vaccinated, or they will be dismissed without pay. So that day is coming Friday of this week, which is, I believe, October 15th. Yes, can confirm, Friday, October 15th. Across Quebec, any healthcare workers who are not fully vaccinated, which means double vaxed, will be facing suspension without pay. And further to that, the nursing board in the province is actually going to be suspending nursing licenses. So we're going to jump into it. This is a story from Steve Rukavina from the CBC. He says, thousands of unvaccinated healthcare workers facing suspension as of Friday. Some unvaccinated nurses in Quebec, who are among thousands facing suspension later this week, told CBC News they feel it's worth losing their jobs in order to respect their principles. The Quebec government set a deadline of Friday for all healthcare workers in the province to be adequately vaccinated against COVID-19. Those who aren't will be suspended without pay. And on Monday, the Quebec Order of Nurses said they will also see their licenses suspending. According to the order, 4,338 nurses aren't yet fully vaccinated. There are also more than 5,000 nurses whose vaccination status the order is still trying to verify. Thousands of other unvaccinated healthcare workers are also facing suspension Friday. In total, the province says 22,446 healthcare workers still aren't adequately vaccinated. Of course, this means that 22,446 healthcare workers will be immediately suspended without pay across the province as of Friday. Now, I'm going to stop reading the story there. If you're interested, of course, you can find it over on CBC. It goes on, as you could imagine, to discuss the impact of these things and individuals' reasonings. They go and he did some interviews with folks who are accepting a suspension. Now, we've talked about COVID mandates here on the podcast. We've talked about COVID vaccines here on the podcast. I was one of the first people talking about COVID, period. So it's been something we've talked about for a long, long time here on the show. And the one thing that we're now getting to, which I think is actually worthy of further discussion, and it's actually an interesting conversation to have, is when you're hearing people say that I'm willing to lose my job, well-paying job, I should add, as a nurse, in general. I'm willing to lose a well-paying job and my license, because it's more than just a job. It's not like they can just leave and work somewhere else. They can't come into Ontario and start working. They can't go to the U.S. and start working. Their license as a nurse will be revoked in the province, which means you can't practice as a nurse anywhere in the world. And to me, that raises this interesting conversation about how we're dealing with vaccine mandates when we're leaving some people so far, we're so far apart, on people who are getting vaccinated and people who are not. And there's such a wide gap now that, I've said before, I understand individuals who choose not to get vaccinated. It's I get it. Fine. You don't want to get vaccinated. Your reasoning may be flawed in some way or whatever. It's something I disagree with. I don't understand how you can reason yourself to that conclusion. I really don't. But you've opted not to get vaccinated. That's fine. I'm not going to be upset with you over any personal decision you want to make about yourself. I've also said I have no problem with businesses mandating employees or patrons be vaccinated. My issue comes with governments. Now, as we discussed, I believe last week, it does get a little bit more complicated when the government is the employer, because in that sense, which with many healthcare jobs, it is government run. They're here, right? They are government positions funded by the government. All of our hospitals are. Some doctors' offices, depending on the province, some dental offices, again, depending on the province, optometrists, that was a very hard word to come up with. Some are funded by the province, depending on, again, where you are in the country. And anywhere where it is funded by the province, I think the province has the right to say that anything provincially funded, whether it's a day camp, a courtroom, or in this case, a hospital, I think, the province has the right to say that their paid employees need to be vaccinated. I don't have an issue with that. The gap that I'm seeing, though, where now people are, it's kind of becoming a little bit mind-blowing that people are so firm in their resistance to getting the vaccine that it's kind of representative of simple stubbornness. They just don't want to do it, so they're just not going to do it, is kind of the vibe that I'm getting. And it's really, really fascinating to see from my perspective, because I like to take a zoomed out approach to things, right? and say, if you're a young person and your job doesn't care if you're vaccinated, your family doesn't care if you're vaccinated, you don't care if you're vaccinated, and you just don't want to, fine then. I get it. That's fine. You work from home. There's no reason you feel that you need to go get vaccinated. Fine. That's your choice. But now when we're seeing people who are quite literally accepting not only a permanent, it's a firing, it's not even a suspension, they're getting fired, and having their professional licenses revoked, which they worked at least 5 years to get, usually 6 or 7, to be fully licensed. You know what I mean? You're literally throwing all of that away for this built-in belief that I don't even know. I don't even get it, because it's not like these people fear the vaccine. That's not what we're hearing. We're just hearing they want the right to make the choice. So they're not getting vaccinated because they're being told to get vaccinated. But you, as a nurse, you literally have to be vaccinated for several other things, right? You can't work in an emergency room without being vaccinated against hepatitis, for example. You can't be a garbage man without being vaccinated against hepatitis and having a booster shot. They won't let you do it because the insurance is way too high, and it's the same thing in an emergency room. You can't work there without having certain vaccines. The military, same thing. You just line up, and they're like, thup, 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 in the arm, right? I think we've talked about that on the show before. And for some reason, this idea of personal liberty, which is extremely valid. It is a valid point. But when I hear your argument for why you're accepting which is what you're doing, you are accepting a dismissal from the provincial nursing board and from your position, your paid job, you're accepting a dismissal because you want to maintain your personal liberty to not get vaccinated. That, to me, doesn't make sense. You're trying to basically be a martyr. And it's such a weird hill to die on, because no one actually cares whether or not you are getting vaccinated as a bottom line note. Fine, you don't want to be a nurse anymore, you can leave and go and try and find another job somewhere else. No one cares. It's a weird hill to choose to die on when you're in such a well-paid position. You know what I mean? There are certain things that come with certain job titles. One of those things with being a nurse is money, right? You're talking about and I understand that some of these nurses work in long-term care homes and stuff. Maybe they're not making in general, nurses aren't making extraordinary money, but you're making good money for someone who doesn't need a university degree, right? You only need 2 years of college, because unless you're licensed to give out medication, in which case you need much more education. But I mean, this is you went to college for 2 years and you could be making $60,000, $70,000, $80,000 a year to start, depending on where you're working, whether it's long-term care, or a small personal care or therapy facility, all the way up to a hospital. And so you're opting to leave all of what you've ever worked for behind because you're saying, no, it's my right not to get a vaccine. And the thing is, it is your right not to get a vaccine. It's your right to walk away from it and not get vaccinated. You can do that. No one is forcing you to stay. The personal liberty comes with whether or not you want to stay And you were saying, no, I don't want to stay, I'm leaving. And then you're blaming them, saying that you had to get a vaccine that you don't want to get. But it's contrary to what you're actually standing for, in my opinion. It seems like you're confused in the political statement you're attempting to make. You're attempting to say that I am losing my personal liberty by staying in this job, therefore I'm not going to get vaccinated, and as a consequence, you are opting to fire me. When in reality, basically, there's another job requirement that showed up. And that job requirement is you have to be vaccinated to keep this job. And people are saying that is against my personal liberties, and now because of you, I'm being fired. When, no, it's not. Your personal liberty is to either get the vaccine and stay employed, or choose not to get the vaccine and accept the firing. That's where the personal liberty comes into play here. So, sacrificing everything you've ever worked for to, I suppose, cash in on the liberty to not get vaccinated doesn't improve your argument that people shouldn't get vaccinated. It doesn't help your argument at all, and it actually doesn't prove that you've lost your civil liberties. In fact, it proves that you're still able to have them fully represented because you're opting not to get vaccinated and you're choosing to leave your job, and no one cares. You're not getting punished in any other way. You're not getting punished at all. You're choosing that path. It's not a punishment for not getting vaccinated. It's a punishment for not fulfilling the duties of your job, just like any other. Now, there are certainly some workplaces where we may end up hearing about them and discussing where it's asinine that they're requiring people to get vaccinated. And we discussed last week about federal employees who are working entirely from home. To me, that's like, I don't know, man. That seems like a little bit of a stretch that you're requiring that person to be vaccinated. But in this case, it's like, no, they have clear medical evidence that you as an employee in this building are either increasing the risk to other people or increasing the risk to yourself, both of which are an insurance concern for your employer. And your employer is saying, just like, we talked about the garbage man, right? The garbage man is not allowed to be drunk when he's driving the garbage truck anymore. They used to be allowed to at one point in time, right? Now you can't. You can't smoke in a garbage truck. Why? Because you flick the cigarette butt and catch all the garbage in the back of the truck on fire. Right? So these are just things that have come about because it's an insurance risk to the company. This is no different, where medical professionals who are unvaccinated are becoming an insurance risk to their clients. If there's a senior home, for example, that says, our staff do not need to be vaccinated, and there's a COVID breakout that is traced to that unvaccinated employee, every single individual who gets sick will have the ability to sue, and if anyone was to die, they most certainly would be found liable of that death. 110% they would be. And they know this. They know this is coming. There's going to be a point in time where people, or where an individual dies in a hospital of COVID-19, maybe even someone who didn't come in with COVID-19. Actually, that would be the best case for a civil lawsuit. Someone comes in with a different issue, contracts COVID, and it's traced to, a doctor, a nurse, something of those sorts. Are you kidding me? As of right now, you can't sue for it because the vaccine is not as widely available, or has not been until now. And they know these lawsuits are going to start coming. And this is how the province is protecting themselves. And it only makes sense from a legal perspective that they are requiring this of their medical professionals in their building. Not to mention, this is a government position here, right? If you didn't want to work in government healthcare, you could have gone to the U.S. at any point in time. You still can. Well, now you can't because actually your license is suspended. So, RIP. But you were able to. At any point in time, you could have left. You could have made more money by working in the U.S. and worked in private healthcare. But you chose to stay here, which gave you more of a safe job here, right? Medical professionals here in Canada are much more safe in their careers than they are in the U.S. However, they do make slightly less money. Many of them are still quite wealthy if we're talking about doctors, but nonetheless, slightly less money. And, you chose that. And how can you expect a politically run entity while that political government is attempting to tell everyone to get vaccinated, and then they have their own medical professionals, you're working under them, saying, nope, don't get vaccinated, I'm not doing it. You expect them to keep you around? How does that make sense? They don't need people preaching the opposite of what they're literally spending tens of millions of dollars to try and get people to do with advertising and research and everything. They're trying to convince everyone to get vaccinated. It has nothing to do with your civil liberties. It is a job, and every job has certain requirements that need to be met. And if you are not meeting the requirements of your job, you get fired, which is what is happening right now to these individuals. And it's not surprising, and I don't feel bad for those people, to be quite frank. Now, one other thing that I want to mention in brief, I guess this is going to be a shorter episode looking at the time. I thought I would have more to say about that, but it's kind of cut and dry. Is that the U.S. is going to be reopening their border to fully vaccinated Canadians in early November. This is from the Globe and Mail. Stephen Chase writing at the Globe and Mail. And he says, Secretary of Homeland Security Alejandro Mayorkas announced the development in a news release Wednesday, saying it was based on guidance from the U.S. Centers for Disease Control and Prevention. The changes will also apply to ferry crossings. He did not provide an exact date in November for the reopening. Canada and the U.S. closed the border to non-essential travel in March 2020 as the COVID-19 pandemic was spreading. And this past August, Canada adjusted these controls to allow fully vaccinated Americans to enter the country. Mr. Mayorkas said the U.S. will also reopen its southern border with Mexico to fully vaccinated Mexicans. It's another development here. It seems like the land border is slowly starting to reopen, which just makes sense. You can't keep it closed forever. Tourism is absolutely being hammered, and this is really going to help as citizens will be able to travel back and forth. You're going to get much more tourism, especially in border cities, which really rely on tourism. It's a very common thing to jump over the border and go to, theme parks and, casinos are really popular destinations, even just a hotel for the night. It's kind of, if you don't live near the border, you might not really know this, but it's just a thing where I don't live too far from the border. It's about a 3-hour drive from here. But it's just a thing where people will be like, yeah, you're going to stay in Detroit or Buffalo for a night or two, and you just get a hotel and you go stay in the U.S. for a few days, and vice versa, right? They come to Niagara, Toronto, Montreal, Vancouver, Calgary, Banff, whatever the city is near you, the spot to be. And it's really popular for cross-border tourism, or rather cross-border tourism is really popular, is what I'm trying to say. And with the borders closed, obviously all of that money has not been flowing in, which has been really, really rough for a lot of these places, especially hotels and, bed and breakfast places and theme parks and whatnot. Even though they've been able to reopen, they haven't had the Canadian or Mexican citizens able to come into the country for travel. Now, Canada did reopen the border to American citizens back in August, as I mentioned, or rather, as was mentioned in the story. And Canadian tourism has had a significant rebound, and I've actually seen a number of American license plates again throughout the region. Actually, when I went camping, I think I talked about this like 2 or 3 weeks ago now. I was camping for the weekend, and there were 2 different campsites that had New York plates that I drove by. So it's, definitely a big thing. It's super common for people to cross the border and drive a couple hours for their vacation in the neighboring country. And it's a really good sign. And now a lot of people are discussing, and I would go so far as to say they are worried about the impact of, COVID numbers increasing. And they have asked both governments, Canada and the U.S., and Mexico as well, really, all 3 governments, to provide details on the numbers that were reached when the government decided to reopen the borders. And I think the thing is, they want to be able to say, they being people who are very liberal on, let's say, on the pandemic, want to be able to say, okay, you were willing to reopen the border when there were 1,500 cases a day. I just made that number up. But when there were 1,500 cases a day, you're willing to reopen the border. Well, now that we're at 2,000 cases a day, shouldn't we close it again? Now that we're at 21, what about now, right? What about 3,000 cases a day? Shouldn't we close the border again? And in reality, the borders are never going to close again in my lifetime. I was surprised they did it to begin with. I'm surprised they were closed for this long. I actually predicted that they would, if you recall, in my January episode, which you probably don't recall because holiday episodes don't get many listeners, but I had predicted that the borders would reopen like by February 1st. Because it was just mind-blowing that they were closed for almost a year at that point. I did not think it would last more than a year, and of course it has. But all that being said, I don't think you're going to be told, well, the reason we reopened the borders was that these numbers were at this point. I think what it comes down to is vaccination levels are at 80% roughly here and in the U.S. I'm actually not sure what Mexico's vaccination levels are at, but I would assume it's somewhat consistent. So now that you're seeing, 80% of the population's vaccinated, well, at some point we have to open the borders. Why not now? It's worked out for Canada. We haven't had any major breakthrough cases because of American travelers. It hasn't been an issue, and I think the U.S. is seeing that. Canada always had to reopen the border first. I think that shouldn't come as a surprise to anyone. But I'm happy to see that now cross-border travel is going to be fully realized. Again, they said at some point in November, it may be pushed to December or so, but I think by the holiday season, they really want it reopened for families to be able to travel, especially traveling down south, like a lot of snowbirds and stuff like that who are traveling for non-essential reasons. They want those people to be able to visit southern U.S., Florida, Texas, California, and whatnot over the winter months, because they really rely on that. So I think that is a major reason why we are seeing this happen now. Either way, that's all we've got to talk about this week. Thank you so much for tuning in and checking out the podcast. As always, you can find all of my stuff over at www.laughtolearnpodcast.com. You can use the contact page to reach me directly. You can also reach me directly on social media. Over on the website, you can find our merch store. Everything is up there. You know what you're doing. If you have yet to do so, hit that subscribe button. Share the podcast over on social media. But, of course, the best way to do it is to just tell your friends and family about it. Send a text or say something in person. That's the best way for you to help get new listeners. And I thank you all so much for telling folks about the podcast. Thank you for tuning in to the end. Keep washing those hands. Keep social distancing. Keep getting those vaccines. Keep on laughing. and keep on learning.